I'd like to welcome you all to this important forum. We think it's quite critical that registered nurses stay in nursing homes, and we want to keep registered nurses, that trained nurse there who can provide the oversight, guidance and care when needed, clinical care when needed.
The Ministry of Health needs to make a decision by the end of 2015. So we want them to keep the legislation as an absolute minimum and to rewrite it into new legislation.
We fear that removing RNs in nursing homes will result in a sharp erosion of care standards in aged care. Registered nurses are crucial to the delivery of safe quality care to our residents in New South Wales nursing homes, because most of our residents suffer from chronic medical conditions that require specialized interventions.
Our population's ageing, and particularly where my brother is in the nursing home, there's a lot of drug and alcohol related mental issues in the patients and residents there. And they're not older people by any means. There's a lot of young people there in this predicament. And there should be someone there 24 hours, 7 days a week.
How can you deliver a good palliative care without a registered nurse with all her knowledge and skills to assess what is happening to the resident? Good palliative care involves being able to anticipate the needs.
What are we going to do? We need RNs. If we have people that have chronic diseases, chronic disorders, who is going to give out their S8 drugs? Who is going to give them morphine if they are in severe pain?
Without registered nurses in aged care, responsibility falls to those who are lesser qualified to be making major decisions about hospital transfers, whether to call a doctor, what kind of treatments to give residents.
Do you and your party support maintaining the legal requirements for a registered nurse to be on duty 24/7?
I have had personal discussions on this matter with the Minister for Health, Gillian Skinner, and aged care workers in the Blue Mountains. And I support maintaining existing requirements for registered nurses to be on duty in nursing homes.
I'd like to say that yes, we support maintaining the legal requirements for a registered nurse to be on duty 24/7. As a state representative currently at for the Greens, I would be happy to continue this conversation after this meeting.
Under an elected Labor government, we would legislate to make sure that registered nurses are in our aged care facilities, in our nursing homes. And should I be elected next week, I'm happy to work with you immediately.
We really, really need to keep fighting for our frail aged because they can't fight for themselves.
If only I have the power to make a positive change to aged care, I will make this registered nurse requirement permanently embedded in our legislation and extend it to all aged care facilities in Australia. Our elderly deserve quality care.